Hello everyone. Today I will cover all the information you may need about 5-month-old babies. I will try to summarize briefly everything you need to do and check from 5 months and 1 day up to 6 months of age, including growth, development, sleep, nutrition, safety, and many other topics. If you are ready, let's start without wasting any time. First of all, we mentioned in the 4th month that it was time to start taking photos of your baby, and we placed a little more emphasis on photography. In the 5th month, however, you should focus more on the play aspect. Until the 4th month, many babies experience colic, and later, around 15 to 20 days of age, you may have encountered a mild sleep regression. After that, sleep usually became more balanced. By the 5th month, we expect your baby to have a more regular sleep pattern. If this is not the case, you should contact your doctor again to check whether there is any abnormal situation. In the 4th month video, we mentioned that your baby could sleep up to 9 hours at night without problems. Based on this, imagine that your baby sleeps through the night and wakes up in the morning. Usually, when babies wake up in the morning, they are cheerful, energetic, and active. This means your baby is ready to spend quality time. During this period, especially the time after waking up in the morning, should be used very effectively. Spend quality time with your baby. Wake up together, go to bed together, and start building a real friendship with your baby from the very beginning. We also mentioned in previous videos that language development was slowly beginning, and even in the 2nd or 3rd week, there were some early signs. At this stage, this development has reached a peak. You should increase how much you talk to your baby and take this interaction seriously. Try to let your baby listen to quality music as much as possible. Instead of concerts with many instruments, choosing simple, rhythmic pieces with a single instrument such as the piano can help develop your baby's sense of rhythm. Piano is one of the instruments I personally prefer for this reason. Just as you need rest after a busy workday or a tiring day at home, the same applies to your baby. Your baby spends the entire day trying to learn everything, absorbing information like a sponge, discover new abilities, and attempting things they could not do before. Do not forget that your baby also needs plenty of sleep to rest and relieve stress. Let's move on to growth. As we mentioned in previous videos, growth is mainly monitored by your pediatrician. Height, weight, and head circumference are measured during routine vaccinations, and percentile curves are drawn. These curves are evaluated by your doctor, and there is generally no need for parents to worry excessively. However, I would like to explain one point that may cause confusion. Babies usually gain weight very well during the first 5 months. After this period, weight gain may slow down, and what I call a correction phase begins. For example, if your baby reaches 7 or 8 kilograms by this month and continues gaining weight at the same rate, they will weigh 13 to 15 kilograms at 1 year of age. How many 1-year-old babies weighing 13 to 15 kilograms do you see? Not many. Therefore, most babies weigh around 8 to 10 kilograms at 1 year of age. For this reason, a decrease in weight gain after the 5th or 6th month is normal, so do not worry. To access our information as early as possible, subscribe to our YouTube channel and click the notification bell. If you do not activate the bell, you may not receive notifications about new videos, even though the information is available. I divide baby development into 2 parts: physical development and brain development. In the 4th month, we mentioned that babies begin rolling from front to back. This month, Your baby may continue trying to roll from tummy to back. Sometimes this process takes longer, so if your baby cannot do this yet, do not worry. It is within the normal developmental range. At this stage, supported sitting should be encouraged, with support to the back, sides, or on your lap, preferably starting on your chest. Observe how well your baby can sit with support. You can also gently lift your baby by holding under the arms and see how much weight they can bear on their legs. This should always be done carefully and in a controlled manner. A quick note: if your baby does not have good head control, do not do this. Lifting a baby without head control may cause harm. Eye-hand coordination continues to improve, and babies begin to intentionally reach with one hand. Rattles and similar toys are appropriate at this stage. During tummy time, your baby can lift their head up to 90 degrees, support their chest with their arms, and pull themselves upward. This will continue, and your baby's interest in objects will increase as vision improves and tracking abilities develop. Another behavior that began around the 4th month is bringing hands to the mouth and chewing on them. This can be normal and may also be related to teething. During teething, drooling increases, nighttime crying may occur, and sleep disturbances can appear. If this is suspected, you should consult your doctor. If teething is the only concern, a low-dose pain reliever may be recommended to see if your baby becomes more comfortable. Now, let's talk about brain development. Starting last month, babies begin forming cause and effect relationships. They may repeatedly pick up a toy and throw it down. This repetition supports learning. During this period, your baby will also develop a better understanding of object permanence. When you leave the room, your baby may realize you've gone somewhere else and may cry after you. Vision continues to improve, although full adult level vision is not achieved before 6 months. Your baby will gradually see objects throughout the room. Interest in different shapes, colors, and contrasts is normal. Babies smile at people, especially those who smile at them, which is a positive sign of healthy brain development. They may also try to imitate facial expressions, such as smiling or frowning. This stage is ideal for play. Babies listen to your voice, try to imitate sounds, and produce cooing noises. In the coming months, these sounds will gradually turn into syllables. Crying also becomes more purposeful. Your baby will cry differently when hungry, tired, bored, or uncomfortable, and may also use facial expressions or tone of voice to communicate these needs. Warning signs to watch for include poor weight gain, lack of head control, inability to sit with support, not reaching for objects or bringing them to mouth, lack of eye contact, absence of smiling, a persistently soft posterior fontanelle, or failure to track bright or high contrast objects. If you notice these signs, consult your doctor to help clarify what a typical day with a 5-month-old baby might look like. Here is a sample routine. Suppose your baby wakes up around 6 a.m. After waking, the first step is feeding, followed by care routines. Since your baby is active, they will want to play. After playtime, about 3 hours later, your baby will get hungry again and may need the first nap. After waking at noon, your baby will be more alert, followed by feeding and playtime again. After another 3-hour interval, feeding and another nap may occur. When your baby wakes up around 5 p.m., they may want a small feeding and playtime. After this point, I do not recommend another nap before nighttime sleep. If your baby shows signs of sleepiness between 8 o'clock and 9:30 p.m., such as fussiness, eye rubbing, or crying, you should put them to bed. After about 8 hours of night sleep, they may wake again around 6 a.m. ideally. There should be one nap before noon and one nap after noon. I generally do not recommend more than 2 daytime naps, as too much daytime sleep can interfere with nighttime sleep. Total daytime sleep should not exceed 3 hours. Sleeping 12 to 14 hours in total per day is considered normal. If your baby sleeps less than 8 hours in total, you should consult your doctor. Regarding daily care, you're already familiar with routines such as bathing, diaper changes, and feeding. This time, I want to discuss care planning for illness. If your baby becomes sick, especially with fever, you should plan in advance who will stay with the baby, whether a caregiver or one of the parents, and whether time off work will be needed. If your baby has a fever, a rash with fever, appears very irritable, has breathing difficulties, diarrhea with blood, foul-smelling stools, or signs of contagious illness, you should see a doctor before continuing care at home. Your doctor will determine whether hospitalization or home treatment is appropriate, and will advise you on treatment duration and follow-up. If your baby has a mild runny nose, mild cough, no fever, no breathing difficulty, and is feeding reasonably well, home care is usually sufficient. For babies under 1 year of age, there is no specific medication for the common cold. Caregivers can manage symptoms with nasal cleaning, temperature monitoring, and fever reducers only if necessary. Regarding nutrition, for the first 6 months, babies should receive only breast milk or formula. Complementary foods can begin after 6 months. Signs of readiness include good head control, sitting with support, bringing objects to the mouth, interest in food, and approximately doubling birth weight. There is no single correct first food. Avoid honey, cow's milk, and fruit juice during the first year. Introduce foods one at a time every 2 to 3 days to monitor for reactions. Do not rush feeding beyond breast milk or formula in the first 6 months. Be cautious with food high in phytates, such as spinach or beetroot, as excessive amounts may interfere with iron absorption and lead to iron deficiency anemia. Balance is essential. After 6 months, complementary food should support breast milk or formula. Breast milk remains the most important nutrition source under 1 year of age. Use a fork to mash foods rather than a blender, as overly liquid textures may delay chewing skills and affect oral, digestive, and intestinal development later on. For sleep safety, place your baby on their back. As babies begin rolling, ensure the sleeping environment is safe with protective barriers to prevent falls. Swaddling should gradually be discontinued and replaced with sleep sacks. Pacifier use may continue. Routine pediatric visits are not mandatory this month, unless vaccinations were missed. You may discuss optional vaccines, such as meningococcal vaccines, with your doctor. Monitor fever carefully. For temperatures above 38 degrees Celsius, remove excess clothing first. If needed, a lukewarm bath may help. Paracetamol is the safest fever reducer for infants. Never give aspirin, as it can cause Reye's syndrome, which may be life-threatening. For now, that's all. Take care and see you next time. Goodbye.